Good day, sir. I'm Francis Josh Sidagohoy from the section BSN 2 to under the Group 2, and I'm going to do my procedural checklist for home visiting performing the bag technique. So, what is bag technique?
Bag technique is a tool making use of public health bag through which the nurse, during his or her home visit, can perform nursing procedures with ease and deftness, saving time and effort with the end in view of rendering effective nursing care.
So, you also have to take note upon using the face mask so that you will not be able to spread any microorganisms or any virus that can cause harm to the patient or as well as to you. So this is really very important, especially now we're having a pandemic, and as well the you should also consider the using other PPEs, which will really be helpful all throughout the procedure. After that, we're going to proceed in the procedure, and first is assessment. So I'm going to gather all equipments needed, such as the PHN bag or the CHN bag, and also the logbook and other paraphernalias. So after that is I'm going to, assuming that I have already identified and located the client or the family, so I'm going to state the purpose of this home visit. So the purpose is to determine the health status and assess the family's situation. So I'm also going to provide for the and observe the health needs for the family, and also after that is I'm going to provide privacy for them. So in providing privacy, I'm going to make sure that the curtains are closed if there are curtains. um, Also, I'm going to close the doors as well as the windows, and as well, it is important to provide privacy because it is for the security of all, and also it gives us the confidentiality if some such circumstances happen all throughout the procedure. So after that is we're gonna proceed to the next one, which is the planning. So in planning, I'm going to formulate the objective for the home visit. Also, it needs to be flexible, and it should be delivered well. So next is implementation. So in implementation, I'm going to place the paper lining on a clean flat surface, clean side out. So here is the paper lining. After that is I'm going to place the plastic lining um, over the paper thing, clean side in naman. So after that, I'm going to place the CHN bag over the plastic lining. And after making sure that the handles are beneath the bag. So after that is I'm going to ask for a water or a dipper of water if faucet is not available. And I'm going to place this outside. So assuming that I have already done that, I'm going to open the bag and take out the hand towel, apron, and place them at the one corner of the working area. And also, I'm going to leave the plastic wrappers of the towel in a soap dish in the bag and then close the bag after. So we're going to take out the materials, which is the apron or the disposable apron, the soap in dish, and the hand towel. So after that, make sure that you will close the bag after. So after that is I'm going to do hand washing and wipe dry with towel. So since we cannot do hand washing right now, what we're going to do is to perform hand hygiene. In performing hand hygiene, we're going to use this 70% alcohol solution, which is the standard and should be used in our community. So going to pump it in my palms, making sure it is deliberately spread well, so that the germs or other bacteria won't contaminate during the procedure. So I'm going to place it right over here then. So after that is I'm going to put on the apron, clean side out, um, not touching the wrong side, and sliding in the head and the neck strap. I'm going to neatly tie the straps at the back. So now I'm going to put on the apron. tayo. So after that is put out things most needed for the specific case being visited, such as pregnant client, postpartum mother, and the newborn, school-aged child, or morbid case, and they are your family caseload. So examples are the thermometer, kidney basin, cotton ball, waste paper bag, BP apparatus, etc. and place them at the one corner of the working area with the plastic or paper lining. And after that, we should also always close the bag. So I'm now going to take out the needed materials or the side materials. So the cotton balls, the BP apparatus, So yeah, I'm going to place it to one working areas, and then the kidney basin and the thermometer, and as well as the paper bag. And I'm going to close the bag again. So after that is I'm going to place the waste paper bag outside the working area. So assuming that I have already placed this at the outside of the working area, we're going to proceed to the specific nursing care or treatment. This is very dependent on the health situation and the client you will be visiting, because such client or other clients may have orthopedic disease like that. So after that is I'm going to proceed to this after completing the nursing care or treatment, assuming that I have already done that, I'm going to clean, wash, dry, and sanitize with 70% alcohol of the things used. This is the 70% alcohol. So assuming that I have already clean it or sanitize all the used materials, so I'm going to do hand washing again. So since we cannot do hand washing, I'm going to pump it on my hands again. So after that is I'm going to open the bag and put back all the materials in their proper places. So I'm going to open the bag, assuming that all these have already been disinfected. So after that is I'm going to remove the apron, folding away from my body with soil folded inwards, and then I'm going to make it remove by clean side out, and I'm going to place it in the plastic bag and put it inside the PHN bag again. So after that, I'm going to do it. Just gonna put it on the side of the kitchen bag. So after that is I'm going to remove after removing the apron, I'm going to clean and fold the linen plastic or plastic lining, and I'm going to place it in a plastic bag or close it in the bag. So this is the plastic lining. I'm going to fold it carefully, making sure, because it may infect or spread the bacteria. After that is I'm going to make a post-visit conference on matters relevant to the healthcare, taking anecdotal notes preparatory to final reporting to my CHN logbook. So after that, I'm going to take note of environmental factors which affect the client's family health. So when I say environmental factors, such as calamities or any disturbances that happens in our environment, especially now that we're having the very relevant and timely, which is the coronavirus we're having. So yeah, we need to take note on that. So after that is I'm going to make an appointment for the next visit, either home or clinic, taking note of the date, time, and purpose. just as how I did a while ago all throughout the procedure. And after that is I'm going to do um, do care keeping the area do aftercare, keeping the area clean and return all articles used in the proper places. So after that is the last part is the evaluation. So in evaluating, I'm going to record all the relevant findings that I have assessed all throughout the procedure, and such as the health problems or any identified problems of the client or the family members during the visit. So I'm going to include the quality nurse patient relationship. So when I say quality nurse patient relationship, I'm going to take gratitude and thanksgiving for the full cooperation with what the family has given me. And also that is I'm going to the refer I'm after that I'm going to document all the nursing care rendered and the procedure that I have assessed. So and I'm evaluating on how effective it is of the how I provide my nursing care. So after that, I'm going to refer to RHU if there are abbreviations for the normal findings. And also the last part is I'm going to record all this on a nursing logbook. So this is my logbook, assuming that I have already assessed it. So after that, we're all done. Thank you, sir.